Shooting electricity through the brain. The controversy over electroshock therapy has been going on for over half a century. Hello and welcome to another edition of the Disability Network. I'm Joe Coughlin. Susan's away this week. Today we'll take a look at ECT, electroshock therapy. Does it do more harm than good for people with psychiatric disabilities? We'll also hear about a daycare center that's run for disabled children in Cape Breton, Nova Scotia. And for all of you chefs out there, we'll take a look at modifications in kitchen design. But first, here's this week's roundup of disability news. President George Bush signed legislation this week that ensures disability payments to Vietnam War veterans suffering from exposure to the defoliant Agent Orange. The legislation comes after years of bitter controversy over the defoliant, which contained dioxin, a suspected carcinogen. Veterans exposed to Agent Orange have high rates of cancer, and children fathered by the vets have a high rate of serious disabilities. For persons with asthma, there is a new drug which is proving useful in reducing both the frequency and intensity of asthma attacks. Linda Steele has this report from Edmonton.
Blow hard. Blow, 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 blow. Keep pushing, 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 keep pushing. Squeeze, squeeze a little longer. Push, push. Big one in. Good job. Okay, come on off.
12-year-old Scott Rice has asthma. In October, he had an attack so severe he was hospitalized for a week. That's when his doctor prescribed a new drug treatment called Zaditen, and the results have been startling.
The lung function study that was just done was a definite improvement over your test in October.
Zaditen is a brand new drug that was developed by a Canadian company and tested in clinical trials here at the Grey Nuns Hospital in Edmonton. It comes in either pill form or in a strawberry-flavored syrup, and it's a preventative medicine meant to be taken twice a day to reduce both the frequency and the intensity of a patient's asthma attack. Asthma sufferers will still have to rely on inhalers for instant relief, but Dr. Fred McDonald says they won't need them as often.
They now can lead what we would hope would be a normal life. They can do the things they want to do and have confidence in their asthma program.
Let's try that.
The new drug does have side effects. Patients have reported short-term drowsiness and in some cases weight gain. But 12-year-old Scott Rice says it's been worth it.
Yeah, because then I could play some more sports in the summer and do some other stuff in the winter, and it's helped me. Like, I've stopped using my ventilator as often. Before it was like every day. Now it's not as often.
And Mum Pat, an asthma sufferer herself, says even pharmacists are giving Zaditen high marks.
He says, you'll love it. He says, I have had rave reviews from people. He says, every person that's come in has told me how wonderful this medication is.
Pharmacists may know about Zaditen, but don't be surprised if your family doctor doesn't. The asthma drug was just approved by the Health Protection Branch, and it's only been available for a couple of months. Linda Steele, CBC News, Edmonton.
These days, you might expect a modern cruise ship to be accessible, but a Dutch organization has taken that one step further. A Dutch charter company has made one of its sailing ships totally accessible to people who use wheelchairs. Working with a volunteer group that promotes water sports for people with disabilities in Holland, the company has equipped the 100-year-old vessel with a variety of assistive devices. Jan Uleva, a representative of the company, talked about the boat during a recent visit to Canada.
This is a very old traditional flat bottom ship. And it is a typical Dutch ship. You can have on the boat 5 or 6, 7 wheelchair people. You can have 20 people on board. The cook is on board, the helper is on board. Also a nurse on board for injections or something. There is an elevator inside, and you can make your own meals or something. And it is absolutely unique. I've never seen it before. I think this is the only one in Europe and maybe the only one in the world.
The first 11-day tour of inland waters in Holland is planned for September. The all-inclusive cost is about $1,000, and that includes transfers from the airport. Auto racing legend A.J. Foyt came close to dying last September 23rd when he was involved in a horrific crash in Michigan. But as they say, racing is his life, and so Foyt is involved in a rehabilitation program working out with the members of the Houston Oilers. Matt Musial of CBS News reports.
6 days a week for 4 hours a day. Anthony Joseph Foyt Jr. is working his way back. Back to the sport that nearly took his life back on September 23rd.
This is actually the car that I got out of. Here's the throttle. All this is out to here, see? Yeah. When it went in, then they cut it here, spread it apart, because it all was wadded up on my feet.
Following that near-fatal crash in Michigan, AJ's feet and legs were crushed, and many thought he would never walk again, let alone race again. But thanks to the guidance of Oiler conditioning coach Steve Watterson and the dedicated hard work of AJ himself, this tough 46-year-old Texan is right on schedule to make his record 34th Indy 500 start in May.
Steve and the crew over there, they've all been wonderful to me, the players, and also I got to thank Bud Adams for letting me use this facility, so maybe I can run with his oil decals on my car if he wouldn't mind for Indy.
And having AJ around every day at the Oiler training complex has had a positive effect on the much younger but not so severely injured Oiler players that are rehabbing this offseason.
AJ actually became a motivator for the players. They saw how hard he worked. Coach Pardee recognized how hard he worked. And Coach Pardee said, hey, I want you in here.
I definitely don't want nobody to feel sorry for me. I want to come back and show them I'm the AJ I used to be.
AJ is back in his shop every day now. He'd been hoping to race his stock car at Daytona in 2 weeks, but he's just not physically able to do that yet. But his brand new Indy car has arrived from England, and it's being painted this week, and he hopes to be in it racing again by early April. That's when he'll head to Indy to begin practicing for his final Indianapolis 500. Matt Musil, 11 Sports.
A federal judge in California decided to go easy on an elderly man in a wheelchair who held up a bank so he could buy medicine. Police say 75-year-old William Hart wheeled himself into the Home Fed Bank in San Diego and apologetically demanded $70 for heart medication. He threatened to blow up the bank with a bottle of nitroglycerin, which turned out to be his medicine. He was caught in a nearby drugstore buying medications. The judge agreed that Hart should not be prosecuted if he stays out of trouble for the next year. And that's this week's roundup of disability news. Coming up, shock therapy or shock damage. Electroconvulsive therapy, ECT, has been used as a treatment for psychiatric disabilities for more than 50 years, and its use has always been highly controversial.
Are you ready?
Electroconvulsive therapy in the past decade has made a comeback in the medical community. Its use is increasing. Doctors say the procedure has been refined, and if properly used, side effects are minimal. But to the public, stark images remain. Like this one from the film One Flew Over the Cuckoo's Nest. At the Clark Institute of Psychiatry in Toronto, ECT is considered an effective and safe treatment. It is used as a treatment for psychotic and pre-psychotic conditions, particularly mood disorders. Doctors there say that ECT may be the initial treatment of choice for some patients with severe symptoms of depression, that ECT is faster acting and sometimes more effective than antidepressant drugs.
There are people who are expert in this.
Dr. Joel Jeffries uses ECT in his clinical practice at Clark Institute. He says its safety and effectiveness are sometimes overshadowed by the stigma.
There's been very good research recently showing that there's no brain damage from ECT. They've done CAT scans and other kinds of long-term memory studies, and really it does not seem, if properly applied, not overdone and with good anesthetic, it does not seem to cause any damage. That's been proven, but that doesn't seem to affect the stigmatization. I think the whole idea of electricity going through a person's brain is pretty scary, and it's hard to get rid of that fear, even though we accept very easily the idea of using 400 volts when people have heart attacks to bring them back to life and stick it in their chest. To use a much lesser amount of electricity on the brain, I think will always have create fear in people's hearts.
The way in which ECT works is not understood, but to be effective, it must induce a seizure in the brain, an electrical storm. Carla McCaig is a disability advocacy lawyer in Toronto. In her 20s, she suffered from depression and was given a series of electroshock treatments. McCaig is convinced that the treatments had long-lasting neurological side effects.
I have gaps in my memory still of a 6-month period immediately before the treatment. I kept thinking that the memories would come back, but they never did. There are sort of random spots missing from 6 months in my life. Second of all, although I would never really be able to demonstrate this, I am persuaded that there was some intellectual impairment, that I was not as smart afterwards as I was before. I could still get to the same place, but it was harder work getting there. And third, I began having episodes that resembled narcolepsy, where I would simply fade out for a few minutes and then fade back in. And eventually I got concerned enough about it that I went off and had a week of in-hospital neurological testing, which established that I didn't have narcolepsy, but I had something, that my EEG was very strange indeed and didn't correspond to any known disease pattern.
5, 6, 7, 8, smash the psychiatric state!
This demonstration was organized in Toronto at the annual conference of the Ontario Psychiatric Association. Demonstrators there claimed that electroshock causes brain damage. Not all ECT patients agree that electroshock causes brain damage. Dr. Norman Endler was the chairman of the psychology department at York University in Toronto when he became depressed. He underwent 7 ECT treatments, and Endler says the treatments saved his life.
Here I am, live and in color. I had no effect on my memory. I went back to being chairman of the department. I had a successful career before, and I've had a successful career since.
People do have,
Dr. Jeffries supports Dr. Endler in his opinion that ECT produces no long-term memory loss.
The whole business of long-term memory loss is a very difficult one. Nobody can prove it on tests. These people, when tested, don't do badly. They do just as well as other people. And there are 2 confounding factors. One is that these people are older now than they were when they had the treatments. And if you talk to anybody in their 40s, they say, my memory isn't what it was like when it was when I was in my 20s. And secondly, anybody who has depression has memory impairment. Depression itself impairs the memory, so that may also be a kind of confusing factor.
But Dr. Joel Jeffries' explanations for memory loss do not provide the answers that Carla McCaig requires.
I think there should be far more looking at people's condition before ECT and after ECT in terms of, for instance, CAT scans. Let's find out whether or not this is really causing brain damage. The Ontario committee that studied ECT reported in its report in 1985 that it's simply not known whether ECT causes brain damage. Well, let's find out. Let's do things like proper monitoring of the machines, modern equipment. If we're going to do it at all, let's at least do it in a way that minimizes the chances of permanent damage.
The debate over electroshock is far from over. In 1985, the Ontario government commissioned the Electroconvulsive Review Committee to study the effects of ECT. It released a report calling for the continued use of ECT, but with recommendations that safeguards be put in place to control its use, and that patients' consent should be required. 5 years later, that report has still not been acted on. Coming up next, Down East Daycare. A daycare center for disabled children and other children with special needs has been set up in Sydney, Nova Scotia. We have this report by Joan Weeks.
This daycare center is the only one of its kind in Cape Breton. It only accepts children with special needs. That can mean anything from cerebral palsy to delayed development or hyperactivity. Every morning, 14 children between the ages of 3 and 7 come here to spend the day.
Good morning, good morning, good morning to you. Good morning, and how do you do? Good morning, Timothy.
It's a small group, but surprisingly, there hasn't been much demand for more spaces. That might be because many parents have no idea that this daycare exists, says board president Malcolm Nemus. Even with the move towards integration, Nemus says this daycare will always be needed.
It's difficult for some of these children to work with large groups in a regular daycare center. So I think, although the move is toward integration, and I agree wholeheartedly with it, I think that the need will always exist for a daycare of this nature.
While other daycare centers might have one teacher for 8 or 10 children, this center has a 1-to-3 ratio. And specialists like Shelley McDougall, who work with the visually impaired, come here regularly. Today, she's helping Brent McLean.
Look, Brent, you can put your head up a little bit.
Brent's mother worked with him at home for years, but Debbie says she never really felt like she was making much progress. He's only been here a month, but already she can see a difference.
At this time, since last year or so, he's picked up an awful lot. But before that, you know, you've been going to doctors and therapists, and you just don't see it. I haven't been seeing it anyway. They have been, but I haven't. But I've been seeing it the last year or so now myself.
So how does it feel to see that?
Good. Feels good, yeah. Makes you work a little bit harder.
Good morning, Paula. Good morning.
It takes special people to work with these children. Sometimes it can take months or years to teach little things that many parents take for granted. Things like washing and toilet training. Paula McCrory has been here for 3 years.
A lot of people say, how can you work there? You know, but it's very rewarding when, you know, when you're doing something good for someone else. It's rewarding.
Some of these children come here for 2 or 3 years, so that teachers get pretty attached to them, and their achievements mean a lot.
Sometimes it feels like that your efforts are all in vain, but when you see a little thing like Timothy, he peed in the toilet yesterday, so it was a big reward for us, because from day one we put him on the potty and his parents started it at home. So when the first time he did, we were all excited, so it's a big reward. Like Amanda, when she came, she couldn't walk, so now she's up in the walker and she's talking, and it's very rewarding to see her up and around.
Special needs daycare is subsidized by the Department of Social Services, so even children from low-income families can use it. And all the kids seem to love it here. Do you like coming here to daycare?
Yeah.
What do you like doing best?
Craft.
What is it?
Craft. Make elephant craft.
You like making elephant crafts?
Yeah.
Yeah? And do you have a nice teacher?
Yeah.
What's her name?
Pasto.
Tasco. And what else do you do here when you're at daycare?
See Taffy.
Sing?
Yeah. I see Taffy.
You see Taffy? Who's Taffy?
She's the teacher.
Going to school or daycare is a big step for any child. Imagine also having to learn to walk or talk at the same time. But these kids take it all in their stride. And with the extra help they get here, most of them are doing just great. At the Daycare Center for Special Needs Children in Sydney, I'm Joan Weeks.
We'd like to hear from our viewers if they think there's a place for segregated daycare. Write to us. We'll give you our address at the end of the show. Coming up next, hot tips on kitchen design. Last week, we showed you eating utensils that are well designed for people with disabilities and others. This week, food is on our minds again. We'll look at the kitchen itself. How can improvements be made there? Richard Dargis is back again to demonstrate. He's a project officer with the Program Technology Branch of the Ontario Ministry of Community and Social Services. One of the problems I have right off the bat is that the counters are all too low. Obviously, this kitchen is designed for somebody who's in a wheelchair. But
that's right, but this section of the cupboard actually is different. You see, it's actually motorized and can be adjusted to whatever height you need to be able to use it.
That's perfect for me.
There you go. The other thing I guess I'd like to point out to you is the sliders. Having sliding doors means that you don't have to duck out of the way, and that makes it a lot easier for some people. The other thing we have here is nice big handles that really make it easy for a person to reach them and use them. And of course a color contrast between the handles and the cupboard.
Now what's that for?
If you have a low vision problem, if you have difficulty seeing things, if you have the handles the same color as the cupboards, they could be very hard to find. Some of the more architectural features again are things like the stovetop. having all of the controls near the front means that they're easy to reach. Now, it is a safety thing that all of these switches must be pressed down and turned. You can't just turn them on. A lot of parents are concerned about that with young children. But when you push them down and turn them, then it works.
Now we have expensive modifications to the kitchen, but we also have some inexpensive ones.
Yes, there are things that can make life easier that don't always have to cost a lot of money. It's like this little mixer here that's designed to actually pump. For some people, this kind of motion with the wrist is really difficult, and this little gadget here can make that happen without having to pay a lot of money. The other thing here, again, it's a little bit of fun, is the talking clock.
It's 11:05 a.m.
And these have become widely available now, in fact.
And those aren't that expensive either, are they?
No, no. They're a little more than the standard electric clock, but not unreasonable price.
Mr. Dargis, thank you.
Oh, you're welcome. Talk to you soon.
Dargis also had another kitchen tip, this one from people who have memory problems. The stove minder is an automatic timer alarm combination that can be hooked up to the stove. It shuts off the elements automatically, and that eliminates the risk of fire. And now we have some letters from viewers. The first is in response to our program that dealt with getting around in winter weather. This letter is from Alan Conway and Monique Baudouin of Hull, Quebec. We are both blind and are particularly inconvenienced because in certain situations, the sidewalks are used as a dumping area for snow that has been removed from the streets. The result is that safety of a motorist is protected at the expense of such groups as seniors and disabled people because we are forced to walk where footing is unsafe or in close proximity to fast-moving traffic. As a further example of the public ignorance shown in such matters, we have a small shopping center located near our home, which is often difficult to enter because the parking lot is never cleared of ice. When we attempt to determine who is responsible for correcting the problem, we are told that the owner of the building, who lives in Montreal, is responsible. The situation is made all the more reprehensible because the complex contains a drugstore and a medical clinic. And here's a letter from Mrs. Sinclair of Welland, Ontario, and it was prompted by our show on travel and tourism. Since acquiring a wheelchair 3 years ago, I have learned a lot of do's and don'ts to make travel comfortable. Advance reservations are a must, but often the management's interpretation of accessibility leaves much to be desired, as you showed. So we always take a bath chair, a toilet extender, shock blocks to elevate beds, a fan to stimulate respiration while sleeping, and a fitted picnic basket. It reminds me of when we traveled with all the odds and ends babies need. Initially, in planning trips, I contacted Tourism Ontario for the most current list of accommodations for the physically disabled traveler. Last September, I pointed out the inconvenience of finding washrooms and/or coffee breaks that were accessible for wheelchairs. Big corporations like Harvey's, Wendy's, Tim Hortons, etc., have gone to fixed table and chair arrangements that make it impossible to park anywhere, and the non-smoking areas are usually up some stairs. Remember, we'd like to hear from you. Next week, in a special half-hour report, we'll see how one Canadian college is grappling with a disability some people say doesn't exist, learning disability. And that's our show. I'm Joe Coughlin. See you again next week. If you'd like to write to the Disability Network, our address is CBC, Box 500, Station A, Toronto, M5W1E6. That's the Disability Network, CBC, Box 500, Station A, Toronto, M5W1E6. Or you can fax us at 416-975-5636.